Start.
Good evening, everyone. I'll be talking on anatomical and visual outcomes in post-traumatic pediatric retinal detachments. So, ocular trauma constitute about 8 to 14% of total injuries, which is the major cause of non-congenital unilateral blindness. It can be divided into open globe injuries and closed globe injuries. And retinal detachment due to these injuries is a threat to vision due to delayed diagnosis and immature visional system. There is higher risk of macular involvement and higher risk of developing PVR also. So we did this study to know the retinal reattachment rates, the visual outcomes, and the factors affecting the outcome. This was a retrospective study done from January 2019 to December 2022. It was a single-centered study, was done after IEC approval. A total of 112 children were taken, aged between 0 to 18 years. With a minimum follow-up 6 months. Myopia and vitreoretinopathies, amblyopia, congenital cataract, and glaucoma were excluded from the studies. A total of 112 children were included, out of which 91 were males and 21 were females. Open globe injury was more common than closed globe injury. At the time of presentation, clear lens was noted in 41.1% of cases, cataract was seen in 53.6% of cases, and subluxation or dislocation was seen in 5.4% of cases. So macula on RD was seen in 53.6% of cases and macula off in 46.4% of cases. Grade C and D PVR was more common in all these cases. So during the initial surgery, lensectomy was done in 66% of cases, for which out of them which 59.45% IOL was placed in the first setting, and remaining 40.54% were left aphakic. They were managed with aphakic glasses and contact lenses. So we found a significant association with PVR grade and the reattachment rates. Lower the grade of PVR, better the attachment when compared to the higher grade of PVR. So vitrectomy was most commonly done surgeries in primary and resurgeries, followed by vitrectomy and encircling band and scleral buckling. So retinectomy was done in 12.5% of cases in primary surgery, and in 71% cases with in resurgeries 1 and 60 in 5 cases of resurgeries. So silicone oil was the most common tamponade used both in primary and resurgeries. Out of 112 eyes, 73 eyes went plain SOR, and 39 eyes, both gas filled and silicone oil filled, underwent multiple surgeries for redetachment under oil. So this is the first picture shows extensive subretinal gliosis, and the second picture shows SRG removal, and the third picture shows post-op attached retina. So out of the total 112 eyes, 11 eyes required the trabeculectomy due to sustained release of IOP, and 12 eyes went for phthisis bulbi. Clear eye was found in 83.9% of cases, and 18 cases had corneal scarring, BSK, and phthisis bulbi. So the most common cause of injury in our study was scissor, open globe injury was scissor, pencil, pen, and stick injury. And closed globe injury most common in, was due to cricket ball, nerf guns, and while playing gilli dand. So retinectomy was most common in resurgeries. Anatomical success was achieved in 79.46% of cases, and 10% of cases developed phthisis bulbi. So pre-op visual acuity was initially low due to the associated corneal edema, hyphema, and vitreous hemorrhage. Single surgery has better visual outcomes than resurgeries. Children undergoing multiple surgery has higher grade of PVR, and the risk of redetachment was also more, and which adversely affected the functional outcome. So 38.39% of children had visual outcome of 1.1 to 1.7 logMAR units at the final follow-up. So, and in the conclusion, traumatic retinal detachments need early recognition and appropriate surgical intervention. Higher grade of PVR associated with more number of resurgeries and worse anatomical and visual outcomes. It is possible to achieve reattachment in eyes with prompt assessment of PVR causing reattachments and performing surgery. Pediatric population are susceptible to traumatic eye injuries, and programs for knowledge, prevention, and awareness are necessary. So limitations are which are inherent to retrospective study. These are my references. Thank you.
Very nice. Now, what is the reason for that 44% remaining aphakic with so much of?
Sir, most of the times the globe in the eye, children are not well developed. For those cases, we left the child aphakic, and once all the retinal detachment, all the trauma, everything settles, we were going for the secondary IOL implantation.
So the vision that you have taken is after the secondary IOL implantation, or it is before that?
After secondary IOL implantation.
After the implantation. How long has been your follow-up for these cases?
It's a minimum of 6 months to 2 years of follow-up we are taking.
2 years. And all the fake eggs you had operated within 6 months of that?
Yes.
That is what it is. Okay.